Both Dr. Johnston and I, my partner, we both worked in healthcare. We're both anesthesiologists, been both working in hospitals and legacy systems for him for about a decade and a half, and me about 2 decades. Most of that time in Wisconsin for both of us. We would go to work and we'd have patients regularly ask us, how much is this going to cost? Should I have this procedure done? What should I expect? And we didn't have good answers for the patients. The honest answer was, we don't know, and the hospital doesn't even know yet. A lot of this is going to come out over the next several weeks or months, and it depends on some of the intricacies of the surgery. We aren't going to be able to tell that to you ahead of time. And we felt like we were accessories to a crime every day, misleading patients, or at least not being able to direct them to true, full, transparent answer. My name is Steve Borene. I'm the CEO here at Renovo Health. I am one of the physician co-owners, along with Dr. Josh Johnston. 2/3 of bankruptcies in the U.S. are due to medical bankruptcy, personal bankruptcies, and most of those people had health insurance. Most people have some health coverage, and they still went bankrupt, right? But people put off care because they know that that's a possibility. They think it's like rolling the dice. Am I going to get stuck with an extra $6,000 bill? And so we've had people who don't have insurance. We've had people who have high deductibles. We have people with regular insurance that everything looks like it's going to be covered. They say, I've been burned on that before. I'd rather go and see you. People are used to getting good health care as far as the quality of medicine, but they're not used to getting the savings. So we've had people here in just a short time that we've been open save $8,000, $11,000 on the same procedure they had just 3 years ago. Oftentimes it's 50 to 60% savings over what the cost would be at another system. And we've done that just by taking out the administrative levels. By switching to a direct pay model, by going into this alternative health system, or what should be the traditional health system, right? This is how it was 50 years ago. We're finding that we can interact with patients in a gratifying manner, just like people could have 2 generations ago, right? So in 1970 to now, the number of physicians and nurses has about doubled in the country. The number of administrators has gone up 3,800%. And so we've removed all the steps that we have found are unnecessary, that don't bring a benefit to the patient or to a physician or to a nurse, to a receptionist, to somebody. It needs to be something that helps somebody either take care of or be taken care of better. And if it doesn't add value in that way, we don't do it. So the decision making is between the physician, medical team, and the patient. We don't have a protocol. We don't have a necessary formula that we follow, that everybody comes in and we ask these following questions because we're trying to get some other data that's going to go into the electronic medical records so that can be sold. A lot of these health systems will go ahead and use that data for a lot of other reasons that aren't helping the patient. So everything we do is directed towards improved care, higher quality care, what the patient needs. There's so many things that we're excited about with this approach. One, the higher quality, lower infection rates that we see in surgery centers. But the savings is what's really catching people's eye right off the bat. There's nothing more gratifying in medicine for me. This has been the most fun, the most fulfilling part of medicine. I've been doing this for over 20 years. I've been challenged. I've been interested. I've made a decent living. I've had a lot of really positive things in my life that have come out of being an anesthesiologist. This is the first time that I've really been gratified and connected with people after I leave. I focus on people when they're in the building, when I'm taking care of them, and it means a lot to me. I care about what their outcomes are. That's always been the case. But now I've got a relationship that's continued beyond, and I look forward to taking care of them, that same person again, down the line. We're glad to be in this space, doing it in this manner, and expect that others are just waiting to go ahead and do the same thing, because there should be 10 places like us in the state. There should be, 500 places across the country doing the same kinds of things, and the physicians want it. The patients definitely want it, and the payers, they need it. It's unlike anything you have in medicine. Unless you have a direct pay primary care doctor, you don't have this anywhere else in medicine, because we can go ahead and direct the care for you. You are the primary decision maker. And if somebody has insurance, oftentimes we can do it still less expensively. So the transparent upfront pricing is right on our website. If it ever does change, make any adjustments, it'll be clear. Any relationships that we have will already be locked in. It's a one-time payment for that procedure. It doesn't change if we have a different surgical finding. It's all included. We can go to the website right now, and we can put in www.renovohealth.care, and you'll see what the offerings are. You'll see the price for that offering, and there's no other bill. Pathology is included, implants are included, anesthesiologist, surgeon, all the fees are all inclusive. And one thing we found is once we get people in the door, we never lose them. We have patients that are going to keep coming back. We've already had family members of initial patients that have come back through. We just need people come in the door, get to know us, get to know the experience. It's unlike anything you have in medicine.